Our next speaker is Dr. Arif Kali. He is one of the founding members of SAMS, the Syrian American Medical Society. He's a hematologist at the Mayo Clinic, and it is my honor to introduce him today.
Thank you all. Thanks for the church for inviting us. Thanks for Congresswoman McCollum for very nice talks. Thanks also for Congressman Keith Allison for all his continuous support. Thanks for all of you who came today and wanted to listen. And also thanks to Mark, my human remote control. Next slide. So I'm going to try to focus on the medical aspect of this crisis. SAMS is a non-political organization, non-for-profit. I hope that through talking about SAMS activities, it tells you a little bit what could happen if you lose what we have right now. Everything that we have right now is automatic. We think that we can get it at any time, but this changes. If you don't know where Syria is basically south of Turkey. It's by the Mediterranean Sea at the far east side of it, and west of Iraq. I'm sure you know about Iraq through the crisis, and many of our U.S. military people were deployed there. So as a location, Syria is very important. It's basically a connection between Europe, Asia and Far East Asia, the Gulf where all the oil is coming from, and close to Africa. So historically, it is a very important piece of land. When the crisis happened, people start fleeing the country, and you can think of all directions. North it'll be to Turkey, and a lot of them actually went to Turkey. South would be to Jordan, and very few went east to Iraq because there's a crisis in Iraq. So it cannot really get all these people. Although a lot of them went to northern Iraq, called Kurdistan, because that area is safe. And a lot of them also went to Lebanon, which is very, it's connected to Syria. Next slide. This is not Second World War. This is actually Syria a couple of years ago. So food became one of the tools to fight people, and besieged areas became a huge problem of this crisis. More than 1 million at one point of people were deprived from getting food, drinks, medications, water, fuel, anything. This is actually what happened when a part of the capital, this is about 10 kilometers, about 7 miles away from the capital. This is called Mukhayyam Palestine. This is where the Palestinian refugees used to live. And it was besieged, and there was one big truck of UN supplies coming. And that's what happened. All the people went out to get food. Next. So the crisis is huge. You've heard the numbers. There are more than 4 million, almost close to 5 million refugees. There's more than 12 million in need, probably almost close to 13 million, which is more than half of the country. Next slide. This is one of the camps by the borders. This actually camp was targeted. There's nothing in this camp except for basically women and children. I went to this camp. I actually practiced medicine in this camp. These are people from the center of the country, from Hama and Homs, and most of those camps have only women and children. I heard that from Congresswoman McCollum. This is true. Why? Because the men either left or they're trying to fight back or do something. So you really rarely see a man. You could see people above the age of 60, and you will see a lot of kids less than the age of 15 or 16. Outside of that, 20 to 50 becomes something impossible to find in those camps. This is Homs, part of Homs. This is the center of this is not the capital, this is the center city almost of Syria. In Rochester right now, we have 2 families, refugees from that particular area, Baba Amro. All this area was basically demolished. They were so happy that they were given the chance after 3 years being refugees in Jordan that they came to the U.S. Their kids are right now in schools. Their husbands both work at Walmart. I'm not trying to promote anybody, but they're building a new life. Next slide. So the numbers, I'm not sure if it's clear here, but the numbers are massive. And you can see the numbers, how they changed dramatically from 1 million in a couple of years to 5 million, in a couple of years to 12 million people in need. Well, I can tell you something, in a year or two, there won't be any change in that number. There's nobody left in that country. If there's only 24 million and we're talking about 13 million left or in need, what's left? Very, very few. Next. This is actually from Aleppo, actually the hometown of our MC. Aleppo was bombarded so many times. And when we had eclipse, I looked in the sky and then I remembered Aleppo. That's how people, that's when they hear the noises of the aircraft, air jets. Everybody start looking, where's the bomb coming? Am I gonna live or not? This is true in other areas. Now, imagine that if there are more than 300,000 who were killed, actually this number is not correct. I mean, the UN stopped even calculating that number at some point. Actually, there's a focus on targeting physicians, MDs, medics, EMS people, nurses. There is a policy behind that. We now understand that. Kill a doctor, then you will make 100 or 1,000 people leave that area. Imagine yourself living in a town where there's no doctor. So the doctors, the hospitals, are the highest between targeted. More than 100 facilities of SAMS actually only were targeted. One hospital in Aleppo, in Sahur, was targeted 3 times. Every time we change the location, it gets targeted. Because they know if the hospital goes out of service, there's about 80,000 in that area right now left, they will all leave. Next slide. So this is SAMS. This is not a new organization. This is Syrian American Medical Society based of physicians in the US. People don't know that, but there's about anywhere between 5,000 to 10,000 Syrian American physicians, which is actually 1%, almost 1% of the doctors in the US. So we produce doctors, basically. Next slide. This is a little bit old slide. Now we have more than 20 chapters in the US, very active. The chapters try to even engage more doctors. There are doctors, dentists, pharmacists, nurses, all involved in this organization. Next slide. So we have our society arm, which is educational. We promote annual events where we talk about updates in medicine. We also try to help physicians, medical students, graduate doctors to get into residency. We give them scholarship. Many of those people come with no money, so almost like a refugee, but they have their degree. So all we do then, we embrace them and we give them a few $1,000s to help them to find a job, and then after that, after a few years, they become physicians. And then they start putting back in our society, which is really a very nice way. We have our own journal that we actually, it's open to people to publish in it. And there's many things. We also do some online courses, try to bring up the level of medicine back in Syria, because those doctors don't have any way to even get trained to know what's the new and how to treat things. Next slide. So our organization grew up so fast from I think about 100,000 annual operation to more than 20 million annual operation. And it's not a secret. We donate time, we donate knowledge, we donate money, and we work also with other partners. So in fact, half of our operation is basically donations. You will be part of that. Even $1 will count there. And the other half is basic grants from many US and international organizations where we basically try to support people. I'm going to talk about this. Next slide. What is our priority? Our priority is to support doctors. Remember, the goal for in this war is to let doctors leave the country, which actually did happen. Thousands and thousands of doctors left the country. I can tell you today there is no single pulmonologist in the city of Aleppo, which is literally the biggest city in Syria. At some point there was 7 million people. No single lung doctor. And I cannot get that to happen. A whole 1 million population does not have a lung doctor. In Ghouta, which is about 500,000 population, they have only one vascular doctor. Vascular is the doctor who treats injuries that affects the vessels. So if you have a bleeding person, if you don't have a vascular surgeon, this guy's gonna die, regardless of what we do. So our third of our money we spend it on doctors, dentists, nurses, everybody. Keep them there to help save those people, save their lives. We can give money, we can give knowledge, but we're not on the spot to help save those people. Next slide. So last year, actually 2014, we had 1.3 million beneficiaries from our operations. 2015, it became actually 2.6 million. 2.3 million actually were benefiting from our operations in Syria, and the rest were actually in the neighboring countries, Turkey, Lebanon, and Jordan. I'm going to tell you a little bit what does that entail. Next. So we do everything. I heard about dialysis. Even a simple dialysis, if you are a patient who your kidneys have failed, which means you only live if you get your dialysis going on, where we get rid of the toxins in your body. You need to get 3 of those a week to stay alive. If you don't have this, you die. Otherwise, you'll be completely normal and functioning. That actually costs $25 per session. So every patient will need $120 per week, $500 per month. So even though there are few of those patients, I can tell you, for example, in Ghouta, which is the area next to the capital, there's only 24 patients. They cost a lot to keep them alive, but there's no other way. The regime, those besieged areas, they will sometimes let food and medicine in, but they will not let the dialysis kit in. It's amazing. Right now, I was in a meeting today in a online meeting for that besieged area in Homs, and they told us that it was one big truck got in for those besieged peoples, and they took off deliberately the dialysis kits. So we do try to support dialysis patients. Dental is amazing. We have a lot of dentists here, and I go and I do a lot of missions, and I found out I cannot help a patient when he tells me I have toothache. I have a lot of medications, not drugs with me, medications, and it stops at the toothache that you need a dentist. And we found out that in SAMS we were not doing this, so we put a lot of focus. We have more than 30 dental clinics, and it's amazing. Now we cannot do bridges and things, fancy stuff. What we can do is, if your tooth is aching you and it's not good, take it out. That's not a lot of cost. So this is actually a big program that's supported by SAMS. That does not get funding, unfortunately, from many organizations. Mobile clinic, we were behind this. We went to the borders, and we found out that there's a lot of people that they cannot have a stationary clinic. So what we do is we go with a little truck, little minivan, and we put a couple doctors and pharmacists and a driver, and we bring the medicine. It's not original. It's been done in the past, but we've made this, on a big scale in Syria. $3 will get the patient a free visit and a free medication, and a free EKG if he's in chest pain. So this is actually amazing. We'll go to a town with 300 people only in the top of a mountain, and we'll say that we're here, and patients know that today is Wednesday and that we'll come for 3 hours. And I did that actually in an area called Idlib, and you'll see that people will be very happy, and that they'll see a doctor. They cannot get a doctor. There is no transportation. There is no fuel. Everybody left. So this becomes the source of life. So $3 actually could get a patient free medicine and a free visit by a doctor. You can't do this in the U.S. yet, but we were able to do that. Psychosocial is a big issue that needs a whole talk. I mean, we see patients, everybody's pain, everybody's hurting, and we know it's not true. They're all psychosocial. They're all somatization of their crisis. They start focusing on the pain instead of the situation. That's a huge issue right now. And we're lucky to have a bunch of psychiatrists and psychologists to now even try to address that. Telemedicine, we have no ICU specialists in Syria right now. Literally. In some areas, we have no doctors. So what do? We have medical students that we train them how to take care of patients when they are on a ventilator. That's when you can't breathe. So you have to put you on a breathing machine for a couple of days to get you better and then take you off of it. So we start something called telemedicine, where we'll tell the doctors, the nurses, the students, do this and do that. And we have a bunch of staff on call 24/7 from the US. In fact, the guy who's created that was a fellow physician from Minneapolis. So this is actually a big thing to be said for Minnesota, that we started a huge program, and now it's becoming one of the most elite programs. Next. So we can stop here, back off. So this is like what I'm talking about. These are the hospitals that getting targeted every day. 2 days ago, Al-Asafir area got targeted. Basically, 3 things: the school, the hospital, and the fire station. It's clear. They want people to leave. Okay, I'll just go. You can.
Oh, sorry, that was the wrong one.
Oh, okay.
I was like, no.
So everything is targeted, even the ambulances. So it becomes an important. Can we get a patient who got a shell to a major hospital? We need ambulances, and guess what? These get targeted. So now many times we don't use an ambulance like the way you see it. We see a minivan with a regular color, so that nobody knows that this is an ambulance, so that they targeted the ambulance. In fact, when I went into Syria, they told me, don't go in an ambulance. You'll be targeted. Go just with a regular car. That's what I did actually. Next. This is a Sahur now. Actually, we built it under the ground, and this is now becoming a theme. All our hospitals under the ground. Protect the medical staff. Next. We can go in a cave. This is in Hama. We built a hospital in a cave. This got targeted just like a couple months ago, but because it's really protected by that mountain, we're able to carry on our operations. Next. This is also in Hama. We're building it completely from the beginning under the ground. Kavarzeda. Next. Next. This is a trip I told you where we went to the top of the hill and people will come. Next, we can pass this. Yeah, this is actually training course for EMS people to come and get to know how do they stop a bleed. We don't have the EMS people. We bring people and train them. A tourniquet is what saves your life. This is what we do in these. Next. Next. This is actually the camp, famous camp, Al-Zatari camp, now is the fourth largest city in Jordan. 200,000 Syrian people, now it's about down to 80,000. This is all camp. If somebody said that, kids and women, 70% of what we see. Next. Medical missions, every 2 months we go in a mission. Next. Next. I'm almost running out of time, I'm sorry for this. We can go forward. This is some of our operations in Lebanon. Next. Next slide. This is actually a mobile dental clinic. I was talking with Dr. Bassas about it. Some areas we cannot bring patients to our clinics, so we bring a a small little machine that a dentist will be able to do this. This is actually in Hama, where there's a lot of people live in small areas. So mobile dental clinic is actually not a common thing. Mobile clinics have been done in the past. We've done this. Next. Next. We've been recognized by many people. State Department, the state of Illinois actually gave a day for the appreciation of SAMS, of what we do to help people. Next. That's what brings me back every year. This is Al-Zatari. This is after our last mission. I'm going to say this quickly. You just missed actually a minute ago before this, actually the dentist was being chased by the kids because he was working on their teeth. They were all hurting and they were paying him back. And once they're done with their revenge, they were all happy and they said, okay, now we can take a picture. So the kids has nothing to do with this, and we need to work to help with the kids. A surgery in Syria costs anywhere between $100 to $500. If you're in a besieged area where I cannot get medicines inside, it becomes $500 to save their life. Next. How can you help? You can help by anything. You don't have to pay to help. You can pray and hope that will help. You can pay and help. You can know at least when people say, why should we care? It doesn't matter. People's lives matter. And at some point we keep saying we don't care, but it will get to everybody. This craziness, this mess. Thank you. Thanks for everybody.
Thank you, Dr. Arif, for another amazing presentation. Our next speaker came to helping the Syrians through one of those events, I believe. Back in November, we had an event with Dr. Khalai also was presenting on that, and Lindsay Smith attended that event, and she was moved, and with her good heart, she wanted to help the Syrian people. She's a nurse practitioner in Minneapolis. So after she heard about SAMS, and SAMS does a wonderful job. I think nobody can beat SAM with their medical and humanitarian efforts. So she actually went to SAM's annual convention in February in Florida, just almost a month ago. And then she applied to be on one of those missions, and they have a mission going on between the Greek and the Macedonian borders. She applied for that and she got accepted, so she just found out about that, and she's very happy. And we asked her to come and speak to us briefly, just to see how, what motivated her, and hoping that other Americans and especially Minnesotans will follow her footsteps, and maybe also helping the Syrian people in their crisis. So please welcome Lindsay Smith.
So I would like to tell you about the trip, but honestly it just came together with the last week. So all I know is what airport I'm going to, and someone is supposed to pick me up. So I'm sorry, I'm a little tall. Since I've shared with people that I'm going, I'm getting a pretty big mixed response. And I think the consistent question has been, why am I going? I came back to Minneapolis after working in Los Angeles for about 10 years and wanted to follow my passion of opening a hospice here. And it didn't take me long to realize that there was a large Islamic population here, as well as a very large disparity in healthcare for culturally sensitive care. So I did like every level-minded person, and I planned a trip to the Middle East. I went for several months, and through several months in several countries, the people I met not only opened my eyes, but also my heart. I met some of the most amazing people with the most amazing hospitality. I would say about 20 pounds worth of hospitality, to be exact. Now when I watch the news and I hear about things happening in these countries, I see my friends, I see the people that I know. I see the people that took me in as one of their own. I knew I couldn't just sit by and not do anything. When I see the people that are affected by this civil war and the victims, I feel that in the future the world will look back and say, how did this happen? In 2016, how did this happen? And I want to know that I was on the right side of that. Sometimes it's overwhelming and you feel helpless. What can we do? What can I do? What can you do? And I remember this thing that I remind myself is that grains of sand form the desert and drops of water form the ocean. And I know that together we can make a difference. We're doing that by choosing to be here today, and I thank you for that. I'm excited because I know I'm going to meet wonderful people, but I'm also nervous because I know that this will change me. It's going to be traumatic, and I know that it will have a huge effect on me and how I feel. I ask especially for your prayers for myself, for the team I'll be joining, and especially the families I'll be working with. Thank you, and thank you for coming today.